This is Far From Home. I'm Scott Gurian. So here we are now 9 months into a global pandemic, and we recently passed the sad milestone of more than 1 billion lives lost, with the US, Brazil, and India leading the pack. In many parts of the world, the virus continues to spread with no end in sight. But even if you're somewhere where the situation is more or less under control, I'll bet that things where you live are still far from returning to normal. Routines like social distancing, wearing a mask, and working from home, which for many of us seemed like strange concepts just a year ago, have now become part of everyday life. And it's hard to let your guard down completely when there's this invisible threat all around you. If you've been listening to this podcast, you know that I started an occasional series where I've been gathering recordings from friends and colleagues around the world describing what the current situation with COVID-19 is like where they live. Last time we heard from people in France, Brazil, Haiti, the UK, Peru, Japan, and the United Arab Emirates. If you haven't heard it, you should go back and listen. Today, I'm presenting more voices from a range of perspectives and experiences. Let's kick things off in Lithuania.
Hi, my name is Vita, and I'm talking for you from my home working table, which became my permanent working place since March. And here I am in my room. Open the door and I am in a balcony. There's a nice yard, a little garden. I just can say that I'm pretty lucky that I'm living in a place like that, not in a flat. I would have felt much more isolated, that's for sure. And animal who is really happy about quarantine is my dog. Dog, say hi. Barsa, say hi. Come on, say hi. Sniff a little bit at least. Make some sound, man. You can make a lot of sounds. Why not now? Hey. No, my dog doesn't want to make any sound right now. But she was for sure very happy about the quarantine. And she was all the time next to my desk, or even most of the time under my desk while I was working, because she was so happy that I'm at home. And now she's so sad if I need to leave.
My name is Aditi Tirani. I'm a voiceover artist based in Bombay, India. At the beginning of this whole situation, I was still in Bombay, living alone, and because everything had come to a standstill, I was stuck at home much more than I'm used to. I obviously started feeling anxious and didn't like that at all, because I'm an absolute outdoors person. I love traveling, hanging out, socializing, and all that had stopped. I thought if I stay like this any longer, I might go crazy. Finally, my brother managed to come get me, and we barely made it back before the highways were shut. I do feel privileged that I could actually manage to get back to my family, because I know a lot of people who couldn't, and I can't imagine how tough it must have been on those people. So it was a nice 5 months of bonding with family. I was surprised how much I liked it. Me spending so much time with my family was unimaginable if you would have asked me before the lockdown.
Hi, my name is Ryan, and I'm recording this in my home office in Pretoria, South Africa. Restrictions here have been lifted recently. We're down to level 1. We've worked backwards from a high of level 5 down to level 1. Alcohol sales were banned for a long time. We actually couldn't buy any alcohol. Also, no sale of cigarettes for quite a long time. And even now, alcohol sales are limited to weekdays, so no weekend sales. That was done in part to try to keep the strain off of the emergency rooms. They thought that a lot of the beds would be needed for COVID cases. Thankfully, that wasn't the case. And so, we're seeing an easing of restrictions. We can move around a little bit more freely. We can go to larger gatherings as long as we, keep our masks on and social distance and all of that sort of thing. Fortunately, the health system has kept up fairly well, even in a country where the health system is strained during the best of times. So I guess that's a positive outcome. But, I think in general, people, just like other parts of the world, have been so fed up with the rules that, we're definitely seeing people not following them, which is a little concerning.
My name is Tony Asios. I live in Guam. It's a remote island territory in the North Pacific. It's part of the United States, though not a state. We've had some moments where our remoteness has been a bit of a saving grace, and in other ways it's made things uniquely challenging. Not that long ago, we felt pretty lucky to be here where the pandemic had hardly touched. And then things changed really suddenly and for the worse. The governor, the lieutenant governor, the governor's adult son, who's the president of a bank here, all tested positive for COVID, as well as dozens of other people across the island. And so all of a sudden we saw our numbers spiking upward, and it's continued in that manner ever since. Now pretty much everything's back on lockdown.
My name is Ophelia Okaikwe. I'm a Ghanaian, and I reside partly in London and partly in Accra, Ghana. At the moment, I've been stuck in Ghana since March. I got caught up in the lockdown when the pandemic broke out. What I have observed is people have various theories and understanding of the pandemic itself and what it means. The masses believe it's a political gimmick. People think it's non-existent. For them, there's no evidence of people falling off. There's no rise in mortality in their community, and so they don't actually believe it's happening. We're enforced, or it's mandatory to use the face mask, they will use it. But other than that, they don't use it.
The biggest problem in a country like India, in a situation like this, is the population and the lack of awareness, even in educated people. I know a lot of people who don't see this as a threat and are roaming around freely even now. And who knows when this is going to end.
We've been living in South Africa for about 6 or 7 years now, and it's always interesting to watch your home country from abroad. But, seeing the, let's say, difficulty that the U.S. or some parts of the U.S. has had with people not wanting to wear masks or not wanting to follow social distancing guidelines or taking science-based health guidelines as an affront to personal liberty is just perplexing, especially from a place like South Africa, where most people understand why it's important to maintain your own health and the health of people around you. And it's been just really wild to watch what's happened in the U.S. on that front.
I don't feel safe visiting our markets because that's where we get our fresh food. I don't feel safe because they're very crowded. They don't adhere to any of the hygiene protocol. So I do my shopping mostly in wayside vendors, because they're by the street side. And all I've got to do is sit in my car like some big madam and call the vendor and say, I want this, and then they bring it to my car. I want that, and then they bring it to my car. So I sit in my car and I get my shopping done. Maybe you can get that in some parts of Africa, but I don't think you can get that in England or in America or anywhere else.
A few months ago, we had our Democratic primaries. Typically, that would be you could visit one of many polling places around the island, and then of course you'd park and walk inside maybe a rec center, a high school gym, a church, whatever it might be, and fill out your ballot and submit it. But in this case, there was only one polling site, and it was a drive-through at one of the main government buildings here on the island. So folks were just lining up around the block, going out to the major road. They roll down their window, they're handed a document, and they're expected to provide their own pen, preferably. So they fill it out, drive up a few feet, and hand it off to someone who slips it directly into a metal box for safety. So that was interesting to see. A Filipino born and raised friend of mine here on Guam recently became a U.S. citizen. And he was informed that it would be a drive-through naturalization oath ceremony where he would pull right up to somebody from the naturalization services and I believe a judge and deliver the oath and then become sworn in as a citizen in his car right there.
South Africa is a very unequal society in terms of economic factors. And when restrictions were the most severe and people couldn't work, it really laid bare how fragile this economy is. You really saw how many people rely on day labor, on the gig economy, construction jobs, domestic labor jobs. And, those were informal economy jobs during the best of times. And then when they disappeared, it was a huge impact on millions of people in this country. And the government tried to step in and respond with grant programs and relief packages, but it just wasn't enough. And so you definitely see people with the means to do so stepping up. And so there are quite a few people who put together, emergency relief funds or pooled money to help groups of domestic workers or day laborers who they knew in their communities that just couldn't make ends meet without being able to work every day. So on the one hand, very depressing and very much opening those wounds of legacy of inequity here, but also uplifting to see people really taking care of their fellow South Africans, fellow humans here, and trying to make the best of it.
Guam being a tropical island near Japan and the Philippines and South Korea, this is a tourism-based economy here, and there's been massive layoffs and furloughs as a result of the tourism numbers just plummeting. We still have very limited flights coming in or out of the island, and those that are coming in are still required to quarantine for 14 days in local hotels. And I live right down the road from many of these hotels, so it's been an interesting experience seeing the major tourist section of town where most of these hotels are located become a ghost town. Because that used to be where the main strip of bars, restaurants, upscale shopping, and now I drove through for the first time in weeks just yesterday, and just completely boarded up. There's just almost no activity. All you see is a few people walking their dogs, a few people jogging. This used to be a pretty congested traffic area, and driving the whole strip, I probably saw 10 other cars.
I think the people with daily wages have suffered a lot. Like in India, we have maids and house help, and there's a lot of them. I also have help, and they told me that most people stopped paying them after the lockdown started, because of which they had a tough time even paying bills and getting groceries.
Lately, I've been waking up worrying because I realized that I'm actually running out of funds, and I don't know where to get my next paycheck from. And it wakes me up at night because I'm racking my brains. What do I do? How do I do it? And I still haven't found any answers yet. But I believe something will drop soon, some solution. So I'm still hanging in there.
I was having a conversation with an anthropology professor at the University of Guam the other day, and he made a really good point about the history of depopulation events in this part of the world, how there are multiple incidences throughout Micronesian history of a ship arriving, and there might be one case of smallpox on that boat, and within a year, half the population of some of these remote, already sparsely populated island nations are just wiped off the face of the map. And so while these events aren't generally very recent, they are still within the collective memory of the people of Micronesia, and that includes Guam. And so I do think that part of the general support for taking an abundance of caution during this pandemic and folks generally cooperating with public health advice and requirements can be kind of tied back to this collective memory and understanding that when remote island nations get hit by a virus, they get hit hard. An interesting thing about the pandemic response is that our governor, Lou Leon Guerrero, is a former nurse, and she takes that former career of hers seriously enough that even though she hasn't worked in a hospital in years, as a point of pride, she maintains her nursing license. It's a sign to the public that she puts huge trust and faith in the public health professionals that work around her and with her and report to her administration. As an American, looking around and reading news reports from other parts of the country, I do feel like Guam is in a better position than it would be if we had a different governor, especially one that might have significantly less respect for medical science.
I enjoyed the quarantine actually, and I don't feel fully confident to say that also because I also recognize a lot of cases when it was hard for people because we were afraid or because we cannot be alone or because we just missed their daily lives of going out, going to events, going to theater, going to concerts. And I know people being affected economically. For example, my best friend, she was fired because she was working in a tourism company, and I recognize all that. But for me personally, I can see that I'm lucky. I really like to work from home, and I'm happy about that because I think my relationship with my boyfriend improved. We just had more time, like lunchtime. It became a nice ritual. Have a break from work, eat together, coffee break, more sharing daily lives. So it's very positive.
As I've learned since March, you can't plan way ahead. You can only plan like a days ahead, probably a week. So I can't say what's going to happen, but I'll wait and see. We just pray and hope that all of this comes to an end soon so we can grab our lives back to normalcy as much as we can.
Right now, the question is, do we have enough resources and finances to be able to provide the vaccine to every person in the country, including the poor, below the poverty line, marginalized people? That's a big concern. I'm trying to put all my energy in staying positive during this time and hoping by next year things will look better for us and the world.
Thanks so much to Aditi from Bombay, India, as well as Vita from Lithuania, Ryan in South Africa, Ophelia in Ghana, and Tony in Guam. If you have a unique perspective or experience on COVID-19 from your part of the world, I'd love to hear from you. Please drop me a line at info@farfromhomepodcast.org. As always, you could follow Far From Home on Instagram or Facebook, or follow me on Twitter. I'm at Scott Gurian. The show's logo comes from Polemic, which designs award-winning experiences all over the world at the intersection of culture, commerce, and community. Find out how they could help your business at polemicdesign.com. Until next time, stay safe, stay healthy, and thanks for listening.